Coming to degeneration and regeneration of the nerve fibers. When a nerve fiber is injured sufficiently, the part of distal to the injury dies. Some changes in the proximal part are also seen. The entire process is known as degeneration, which is also called as Valerian degeneration, after Waller, who described it. Some of the common causes of injury are transection, crushing injuries, injection of toxic or poisonous substance to the nerve, ischemia or interference in the blood supply, hypopyrexia, that is increase in the body temperature, can lead to uh, injury. The grading of the injury is based on Sunderland. So they are called as first, second, third, fourth, and fifth degree injury. First degree injury is where, I mean, it is most commonly seen and is secondary to ischemia caused by direct uh, pressure to a nerve or for a limited time. Ischemia produces local anoxia with a temporary impairment of the nerve function. It gets corrected within hours or to few weeks because of the axon is not destroyed but merely loses its functional properties for a short time. Second degree injuries. It occurs because of the prolonged or severe pressure damages the nerve fibers at the pressure point and eventually causing the death of axon locally and distally. Third degree injuries where there is endoneural tubes becoming interrupted, and the fourth degree injuries where the fascicles becomes disorganized, and fifth degree injuries where through and through cutting of the nerve fiber occurs, that is in case of complete transaction. The degenerative changes occur at three levels: the changes that can be seen in the nerve cell body, changes that seen in the distal stump, and changes that seen at the site of injury. Series of degenerative changes. The change in the nerve cell body begin within 48 hours of injury. There you can see the chromatolysis, the Nissen's granules, they disintegrate. The Golgi apparatus, mitochondria, and neurofibrils are fragmented and they disappear. Cell draws more fluid and become round. The nucleus increase in size and move to the periphery. The changes in the distal lump begin within 24 hours of injury. The axis cylinder breaks into short segments and few days later and little debris is left. Then myelin sheath breaks up more slowly than the axon into small oily droplets. It occurs in two stages. The physical destruction occurs up to 8 to 10 days, and the chemical destruction starts on the 8th day and goes till 32 days. The nucleus of the Schwann cell starts multiplying mitotically, which fill up the endoneural tubes. Macrophages from endoneurium starts phagocytosizing debris of the axis cylinder and myelin sheath. Once the debris is cleared, Schwann cells cytoplasm starts proliferating and it fills up the endoneural tubes. Changes in the site of injury, that is Schwann cell, differentiate into thin elongated cells, mainly from the distal end and very little from the proximal end. It can bridge up to the gap of 3 centimeters, and the rate of progress of the growth is around 1 to 2 millimeters per day. There can also be regenerative changes. A degenerated nerve may regenerate provided there is a neurolemmal sheath. In places where the neurolemma is absent, there can be no regeneration. Nerve fibers of central nervous system, therefore, once degenerated, never regenerate as these nerves have no neurolemma. The degenerative and regenerative process go side by side. The changes in the nerve cell body begins at around 20 days and is completed within 80 days. The Nissen's granules and Golgi apparatus gradually reappear, cell regains its normal size, and nucleus returns to its central position. And the repair of cell may even occur if the axon does not regenerate. The changes in the distal stump and at the injury is accordingly occurs. Axis cylinder from the proximal stump elongates and then grows out in all the direction as rounded pseudopods like structures called fibrils towards the distal stump. Each axon gives rise to 50 to 100 fibrils, which are guided by strands of Schwann cells into distal ends of the endoneural tubes. 2 to 3 weeks after the nerve section, the distal endoneural tube contains varying number of developing fibrils. Eventually, all the fibrils reinnervating one tube degenerate except one, which thereupon progressively gets enlarged to fill the tube. To begin with, the rate of growth is around 0.25 millimeters per day, but once it enters the distal stump, the rate of growth becomes 3 to 4 millimeters a day. As it grows deeper down, the rate of growth further increases because of the mechanical conditions for the regeneration are more suitable than those in a cut nerve end. In approximately 15 days, Schwann cell filling the endoneural tube starts lying down the myelin sheath around the successful fibril, which is completed by 1 year. Increase in the fiber diameter takes place very slowly, and the final diameter is attained is 80 to 85% of the normal. It is limited by the diameter of the distal tube and the size of the parent nerve cell. Therefore, functional recovery is not full, which takes a longer time and may be associated with a different complication if it does not reach its own cut stump. That is why, therefore, motor nerve recovery may be complete, but for a mixed nerve, it is rarely so. So this diagram showing the degenerative and regenerative changes. When the axon is severe, the distal part degenerates and it is called as Wallerian degeneration, and you can see some changes in the cell body also, where the Nissel's granules they disintegrate. Okay, and the degeneration and regeneration, they occur parallelly. The stump, it starts giving pseudopods. There will be plenty, and one pseudopod or fibril will be able to successively penetrate into the neuronal cells. I mean, if the neural lemma is intact, okay, and which eventually grows, and it is going to reach to the target end, and it completely